Wake up, everybody, let's elevate your mind. Live your life without limits, no more wasting time. Don't forget to stay focused while continuing to stay on the grind. Keep your vision real tight, then your future be bright until the finish line.
Good morning, Living Your Life Without Limits family. Thank you once again for joining us for this week's episode titled Mental Health Awareness. And I have a special guest with me today, none other than Dr. Michael Tolwin, who is the CEO of Tolwin Psychiatric Medical Group. Dr. Tolwin, thank you once again for joining us here on Living Your Life Without Limits.
My pleasure.
Today, our focus is for Dr. Tolwin to help us have a better understanding and hopefully also remove the stigma around mental health. Many people in many cultures tend to label people if they have mental health issues, and it is also considered a disease. As well as he's going to talk to us a little bit about the COVID-19 impact on people in social isolation. So I'm going to turn it over to Dr. Tolwin. And the first question that I want to have is Dr. Tolwin talk to us about what is the meaning of mental illness?
Okay, excellent question. Just as there are physical illnesses that affect our body, there are also mental illnesses which affect our mind. And what's important to recognize is that the most important thing is functionality. It's important that we are able to function in society. So when someone has anxiety, fears, feeling depressed, and also for those people who are not in touch with reality, not knowing what reality is, that will interfere with a person's ability to function in society. In that case, they have what could be considered a mental illness. Now, from my perspective, I believe everybody has mental illness because I believe nobody's perfect. Everyone has issues. And I think that's a very positive perspective to take because we can all work on ourselves. All of us have different issues, fears, concerns, anxieties that interfere with our functioning. And we can work on these and improve on them. And everybody is a person. Someone with schizophrenia is a human being. Someone with depression is a human being. Everyone is a human being. That we start from there. And we have to respect each other, knowing that we all have limitations.
So thank you for that. What causes mental illness? And I understand your view of everyone has mental illnesses or mental issues,
Yeah.
but there is that line of where some people, need medical attention, where the boundaries are blurred.
Okay.
So what are some of the causes? Because many people wonder, do they have mental illness, or when is I know it needs to be diagnosed by a professional such as yourself, but what are some of the causes or maybe some of the things that precipitate?
In terms of some of the causes, we have, it could be to a certain extent genetic. Sometimes there's genetic disorder. Mm-hmm. And sometimes it's basically comes to being a biochemical disorder insofar as we are biochemically based. So if, for example, someone's hormones are out of kilter, let's say your thyroid is low, someone with low thyroid is going to feel depressed. Someone who has low glucose is going to feel down and have low energy. Someone who doesn't have enough serotonin in their system. So it's biochemically based and also environmentally based. For example, if you are all alone during, let's see, this coronavirus epidemic and feel lonely, nobody to talk to,
Mhm.
it's understandable that you're going to feel more depressed, feel isolated,
Mhm.
feel more hopeless and helpless and worthless and overwhelmed with being by yourself, not being connected, which is a very important issue. That is connection. Um, it's very important, being human beings, that we connect with other people, that we have connections. And another perspective of mental illness is when those connections are not good.
Mhm.
And the question is, and what is interfering with those connections? So we can say that a person who isolates him or herself uh, is going to feel more depressed. And it's important to make connections with other people, especially during this time, to go out and call people, get on Zoom. It's amazing. Thank God we have the internet at this time, because without the internet, I don't know what we would be.
Mhm.
But we should use it. We should use the phone. We should reach out and connect with other people, because basic needs of humans is that we have a relationship. In fact, I believe a relationship is the most important value for human beings. And anything that will interfere with relationships will cause ill health, and anything that will foster and improve relationships will improve health.
So that brings me to my next question. So, how do we know the warning signs so that we, as family or friends or even ourselves, if we're at a breaking point, before we go off the edge or become in a total, as they call the layman term, breakdown state? So, what are some of the warning signs that we should be aware of? So, the triggers or the warning signs that would
Okay.
help us to be able to identify and seek the help that we need. Because one of the things I wanted to make sure that people understand, as you first brought out, everyone is human and it's okay to say, I need help. Because certainly in certain cultures, particularly in the African American culture, oftentimes mental health is viewed as a negative stigma. And I'm sure it's in other cultures as well. And so people hide behind feeling something's wrong. So talk to us about that so that we can, let people understand what are some of the potential warning signs that they may need to not deal with this on their own, but seek professional help.
Okay, great. Well, again, first of all, I want to emphasize that everybody has issues.
Mhm.
Everybody has mental issues,
I agree.
no matter who they are. It's just a matter of degree.
Mhm.
Now, when the issues interfere in our relationships, that is more serious.
Mhm.
So if you have somebody who finds themselves more isolating, not communicating with others, um, in basically their own little world, these are serious warning signs that something's not right. When it's difficult to communicate with somebody, that's a warning sign. When someone's so withdrawn, that's a warning sign. Someone's so anxious that they're not able to communicate, not able to socialize, that's another warning sign. So all these are warning signs when people are trying to make contact with another and there are some walls that they feel they're not able to penetrate, they're not able to get through to the person, and the person is not communicating with them. Again, these are warning signs that something isn't right.
Mhm.
Now, we might all have times when we feel that way, and it's a matter of degree as well,
Mhm.
because sometimes we don't want to communicate. Sometimes we just want to have our own space, and at times that's fine, that's okay. But if it's on a regular basis and it's interfering with our functioning, then it's more serious.
So anything that kind of tends to be more extended. What about when people have rage or violent tendency? Sometimes that borders in there too, where a person can be very angry and just abruptly angry. We all, like you said, have issues and can be angry at times and blow up. But, you know, sometimes there's a build. You hear about those stories where there's a build up. It started with some small things, and then before you know it, it's a huge event where it can become violent in that situation. So it brings me to the question, when is it appropriate to see a psychologist versus a psychiatrist? And what is the difference? I think oftentimes lay people confuse the difference between a psychologist and a psychiatrist. Can you define the difference for us and what that means, and when to seek help from either or both?
Right, great. So the basic difference is a psychiatrist is a medical doctor.
Mm-hmm.
So he's gone to medical school. So psychiatrists are allowed to prescribe medications.
Mm-hmm.
A psychologist talks to the person and tries to use different behavioral or communication techniques to find out what's wrong with the individual and try to help them along.
Mm-hmm.
So a psychiatrist can do all that plus give medication. Sometimes, as I mentioned, a person may act a particular way because they have an organic medical issue, such as low thyroid.
Mm-hmm.
And so a psychiatrist, being a medical doctor, might be more attuned to that, could order testing for that, and then refer the particular patient to an endocrinologist further to get further medication.
Mm-hmm.
So again, the basic idea is the psychiatrist is a medical doctor and prescribes medication.
Okay.
The psychologist is more talking therapy.
Mm-hmm. And with the psychiatrist, you can get the combination of both.
Correct.
So in terms of diagnosing a person, obviously that comes from the psychiatrist that does the diagnosing, but is it a battery of tests that are done before going into something that's more severe? Or
a psychologist can also make a diagnosis as well.
Mm-hmm.
And in terms of severity of the illness, that depends upon the functionality of the individual.
Okay.
To what extent are they functional?
Mm-hmm.
And what are their symptoms? For example, you can have an individual who has psychotic symptoms, meaning they could, let's say, hear voices, respond to internal stimuli. But if they're taking their medication, they can be functional. So the purpose of the treatment is to get the individual functioning. And the medications are amazing in today's society. It's just, thank God we live this year, because there are so many very great medications that are very effective with minimal side effects and can get the individual functioning. And I'm every day it's amazing. It's miraculous. But if you understand that we're biochemically based, if you give the individual the right combination or the right medication that has the right biochemical that they're missing, the person can function. And if they don't have it, the person is not functioning. Mm-hmm. And it's quite dramatic. What's important, I would say, is for everybody to recognize that nobody is perfect, and to get feedback from our family and friends, and to have some trusting relationship. So if our family and friends are telling us something, we listen. So if they're saying, something's not right, you have these rages and you should be able to control them. And if the person, for example, is not able to control the rages, maybe there is some sort of biochemical imbalance. And by taking a little pill, they can get that imbalance and function so much better and be so much happier, and society can be so much all the better for it. Why not?
I agree. I think that that's one of the reasons why I wanted to do this, because it's, as the title is called, it's thriving, not just surviving. Because there is so much, as I said, stigma around mental illness. People are labeled as crazy, or people don't want to be bothered, or they just say, you know, so and so is crazy, and they're dismissed. And having worked in the area of mental health myself, when I was working within acute care hospitals as a chief operating officer, I saw, you know, we had 98 beds, and people, you know, were having real struggles. But I wonder how many, before they got to that point, as you talked about, had that supportive environment and therapy. So for those that maybe don't have that, that maybe don't have family and loved ones, are in a isolated point, whether they put themselves there or just the way their life is structured, what do you say to them? How can you encourage them to go about seeking help? Because maybe there's not someone that have identified for them or talk to them to say, hey, this is a concern.
Well, it's important that we be aware of ourselves. Know yourself.
Mm-hmm.
So if we are feeling isolated, disconnected with other people, that's a warning sign in and of itself. And maybe it'd be worth contacting a therapist. There are enough therapists around, and then talking to them and getting a perspective from someone who's objective, how, and explaining how they're living their life and maybe ways to improve their life. I emphasize that all of us have issues.
Mm-hmm.
And that's very important to recognize, because it's not the other person is crazy and I'm perfect. No,
Right.
we are all crazy on a certain level. We
Right.
all have issues, and
Right.
it's the smart people that recognize it. And the most difficult times I have is when you have people who say they're perfect. Anyone who says they're perfect, they're not.
That's correct. That's correct. That is so true. We all have a measure of mental illness, as you said. But it's what you're emphasizing, what I'm hearing today, is identifying it and taking the measures to get better and have mental health with it. So the question becomes, what are some of the treatment options available? I know you spoke about medications, but are there any other things that can be uh, used to help when we have those moments, whether it's a small degree like a panic attack or anxiety, or something of a more severe degree where, like you said, like a personality disorder, where, you know, what are some options besides medication?
Of course, right. There are many options besides medication. First of all, if one finds oneself isolating, we can spend time socializing, put ourselves out, try to socialize, interact with other people. It's very important to exercise. Exercise is a great treatment. Taking walks, regular cardiovascular exercise is extremely important. Eating healthy foods, what we put inside of us makes a big difference.
Mhm.
And as I mentioned, connection. Connection, relationships is extremely important. And as I believe, the most important value in society as human beings. So it's important that we foster and encourage relationships with friends, family, religious organizations, different organizations, with God, a higher power. All that is important.
Excellent. Thank you. So you're hearing on the news, and I'm sure you have, and probably even more so than I, that the suicide rates are going up. Segueing into this, suicide rates and isolation, and many of the elderlies who lived in assisted livings and skilled facilities, they're on lockdown. They can't get visitors. What are some of the things that you encourage people that they can do now to help cut down some of the stress and anxiety and depression associated with the social isolation? Or you're also hearing about cabin fever where couples are fighting more and domestic violence calls are going up, and it's like it's too much connection in one period on some end, and then there's none on another. So talk to us about that and what we can do in society, and we as individuals, and even in our homes, to help during this time of social distancing.
Great. It's important to have a positive perspective. And
Excellent.
every situation is a challenge. So we can take this as a challenge, as an opportunity. And while there's a lot of negativity associated with the illness, we also recognize that we're all connected. It's, in a sense, this is like a giant Earth month. It's not just Earth Day, it's
Yes.
or Earth months.
Yes, yes.
Where we can appreciate we're connected to each other and we're connected to the world. And that connection is important to recognize. In terms of time we spend by ourselves, we can take this as an opportunity to meditate. We can take this time to read, to learn, to think. Really, this is a break. This is like a long Sabbath, which could be considered a curse because you're not working, or a blessing because you're not working.
Right. Depending on how you look at it. Yes.
It depends how you look at it.
Yes.
But if you take this time, this opportunity to think of what direction are we going in? What are our values? Because oftentimes in society, we're so pressured all the time, moving constantly. And that's the general Western society, that we don't have time to think.
Give our brains a rest.
Give the brain a rest, right? But we can rest and think about something else. We can think.
Yes.
Because if our brain is constantly moving, our bodies are constantly moving, there's no time to think and reflect. This is an opportunity to understand, well, what are our values? What's important to us? And how are we going to move forward?
That is beautifully said. And that's what we've been talking about on Living Your Life Without Limits. And I think you came and affirmed that. These are some of the same things, maybe said in a different way, but certainly affirming what we've been discussing. So as we're wrapping up our time here today, Dr. Tolwin, what is the one thing that you'd like to leave with our viewers and our listening audience that will give them hope and encouragement, not just for this month, but going forward for the rest of the year? What would that message be?
I would say the importance of recognizing that we are all one, we are all connected. More so now than ever before, we realize that here this virus started in one place and it's all around the world. And just as something negative can spread, we can also spread positive energy, positive forces, being connected, appreciating the blessings we have, and sharing blessings with others.
Beautiful, well said. And to people, what is your final thought to people that may be struggling with mental health or mental concerns? What would that be?
And that is, realize you're not alone. Make the effort to connect to people, contact therapists, psychiatrists, mental health workers, and recognize that everybody has issues. Everybody, including myself.
Thank you again, Dr. Tolwin, for your time, your expertise. Dr. Tolwin has been practicing, is that about 30 years, I believe, Dr. Tolwin, I saw on your resume?
Probably more.
It's probably more than that. So he has a wealth of knowledge and experience. We're going to put how to reach him on our email link. And again, thank you for your time. And thank you, viewers, for tuning in. And this was such an important message to let you know you are not alone. Mental health, as Dr. Tolwin eloquently put it, is in all of us. We all need it. We all need to connect. We all have moments where we feel anxiety, depression, and sometimes a little off kilter. So you are not alone. So seek the help and the support, your outreach. Bond even during this isolation. And we want you to know that we love you here at Living Your Life Without Limits, and we want you to thrive, not only in social distancing, but in your life. So your mental health is important as well as your physical health in every aspect of your body. Once again, thank you for joining us. I thank my special guest, Dr. Michael Tolwin, for his time and his knowledge and expertise. And remember, family, to love yourself, take care of yourself, because guess what? You're worth it. Stay tuned, stay connected. Visit all of our social media sites. Log on to our YouTube. And remember, we're just getting started. God bless you all. Look forward to seeing you next week. Thank you again.
Thanks for joining us here at Living Your Life Without Limits with your host, Shannon Jackson. You always know she always brings you quality content all the time with each and every episode she creates, and that is just for you. You know, Shannon has done her part. Now's the time for you to do yours. You need to take action. Show her your love. Click on that subscribe button and get your content every single week. Quality content you can find nowhere else. Want more content on the go? No problem. Go to our website at livingyourlifewithoutlimits.com. We're also on the social media sites like Facebook, Instagram, Twitter, Reddit, LinkedIn, iTunes, and Spotify. Thanks again for joining us today. Tune in next time for another episode of Living Your Life Without Limits, and subscribe today.